Hello dear all, hope you are doing well. We are going to discuss about the dosage form today, and let's start from the introduction. And the introduction is quite simpler one, that the what is the dosage form, and it is mixture of active drug component and non-drug component. Active drug component is also called the active pharmaceutical ingredient, and non-drug component is called the excipient. So question arises why there is the need for the dosage form, and we have four parameters that tells us the need of the dosage form. First parameter is that we want accuracy in the dose. Second one is the masking, taste and odor. Next one is the controlled release, and last but not the least is the use of desired vehicle. To achieve these desired features, we need the dosage form. So if we classify the dosage form, it can be classified on the basis of physical forms or on the basis of route of administration. And on the basis of physical form, there are solid dosage forms, semi-solid dosage forms, liquid dosage forms and aerosols, while on the basis of route of administration, there are oral, topical, parenteral, inhalants, ophthalmic, otic and rectal dosage forms. So let's discuss one by one that in oral dosage forms there are tablets. These could be buccal or sublingual tablets, effervescent tablets, capsule, dental cones, powders, solutions, emulsion, suspension. All these are used for oral intake. Then there are topical dosage form, and there are various topical dosage forms including ointments, creams, gels, poultice, paste, transdermal patches, plaster and liniments. And if we talk about the parenteral dosage form, there are different route of administration like intravenous injections, intravenous infusions, intramuscular injections and subcutaneous injections, and their angle of administration also varies. And if we talk about the inhaled dosage forms, we use the inhalers and nebulizers. And nebulizers are the machines that turn the liquid medication into an inhalable mist, while the inhalers are pocket-sized device that dispense medication as spray or inhalable powder. Then there comes the ophthalmic dosage forms like the drops and the ophthalmic and eye ointment, and then otic dosage forms like air drops that are instilled into the air with a dropper like the antibiotic gentamicin. And if we talk about the nasal dosage forms like nasal drops and sprays, these are instilled into the nose by a dropper, for example betamethasone, beclomethasone and many more. So this is the route that is also desirable. And then rectal dosage forms like the suppository and enema. Suppositories are medicated masks that are inserted into the rectum or vagina like meloxicam, that is actually a painkiller. And then there is the enema that is used for the constipation or these kind of problems. In this enema, liquid is introduced into the rectum or colon, and here is the diagrammatic representation of the enemas. And it is a layout for the solid dosage forms, liquid dosage forms and semi-solid dosage forms. And you can comprehend all the parameters in these slides, that how we can divide further the solid dosage forms into the unit dosage forms, and the bulk unit contains the tablets, capsules, powder and pills, while the bulk contain for internal and external, and these are other types. And in liquid dosage form there are monophasic and biphasic, and biphasic very two well-known names like the emulsions and suspension, while for the monophasic there is internal and external phase like syrups, elixirs, linctus and drops, and external phase contain liniments, lotion, gargles, throat paints and many more. For the semi-solid dosage forms, internal and external also exist. Like for the internal semi-solid dosage forms are suppositories and pessaries. Suppositories are for the rectal use, while the pessaries are for the vaginal use. External are the ointment, creams, paste and jellies. So these are all kind of dosage form. And next comes the active pharmaceutical ingredients. And active pharmaceutical ingredient is part of any drug that produces the intended desired effect, that is called the active pharmaceutical ingredient, like the acetaminophen. And some drugs also contain the combination therapies, so there are many active ingredients. It can be 2, it can be 3, or it can be 4 also. So we can also classify the APIs also on the basis of psychopharmacological agents or pharmacodynamic agents or chemotherapeutic agents, and are the agents acting on the metabolic disease and endocrine functions. So psychopharmacological agents includes the drugs that act on the CNS, that could be the antidepressants, that can be the hypnotics, that can be the sedatives, that can be the anti-Parkinson agents. And for the pharmacodynamic agents, these are the drugs interacting with normal dynamic body process. These include antiarrhythmic drugs, hypertensive drugs, anti-allergy drugs, and this is the thermodynamics that includes the mechanism and effects and medication and what medications do and how. Then there comes the chemotherapeutic agents. These are the selectively more toxic for the disease causing microorganisms. They include antibiotics, antivirals, and antifungals. Then there comes the agents that act on the metabolic disease and endocrine functions, for example, for the treatment of diabetes, inflammation, and atherosclerosis. So there are also many factors that influence the dosage form choice, and these factors could be patient oriented, like the age and cognitive functioning, understanding, living condition, illness type and factors, safety, ease of use, and all these. And if we talk about the route of administration, that could be the local delivery or systemic delivery. Systemic delivery is directly into the blood, and local delivery is for the external or easily accessed and effective approach for receptor targeting, but it is not easily accessed, as you can see from the slides. And then there is the last slide, and excipients we will discuss in the next format.